Panelists, we have your names here. First, we have our pediatrician panelist, Dr. Carolyn Cleary from Elmwood Pediatric Group here in Rochester. Orthopedic surgeon, Dr. Susan Nelson, and orthopedic surgeon and panelist, as well as workshop leader, Dr. Andrew Dubina, both of them from the University of Rochester. We have our physical therapist and workshop leader, Suzanne Callan Harris, who will be joining us here today. We also have our yoga instructor and workshop leader, Tricia Coleman, who will be joining us. Yes, Ms. Tricia here, as well as a panelist and parent of a child with scoliosis, Dr. Emily Cullington, adding a very unique perspective to all of our panelists who are joining us here today. OlaRose will be moderating, so we will be hearing her ask some questions and inviting our panelists to, again, share their expertise. And then we will also have an opportunity for all of you to ask questions in just a moment. So I'll leave the microphone here with you guys, and you can pass it around per se. Yes.
Thank you, Ms. Singleton. Thank you, Ms. Singleton. I'm very glad to be the moderator of this panel discussion. Thank you to all of our panelists for being here and sharing your knowledge and your expertise. Today, we will discuss scoliosis, the effects of the condition, and how to manage it physically and emotionally. First, I will ask each of the panelists their questions in the order that they are sitting. Second, the panelists will get the opportunity to comment on the information that was shared. Lastly, we will open up the discussion to the audience for a question and answer session. Therefore, please wait until the panel discussion is over to ask any questions that you may have. Now, I would like to start the discussion with you, Dr. Cleary. Children are often told of the physical effects of scoliosis and are unprepared for the emotional toll that it may have on them. As a pediatrician, when you diagnose children with scoliosis, how do you support them emotionally, or what is your first piece of advice to them?
Well, I think as I'll just try to speak loudly. I think, as you pointed out in your presentation, having information is important. Scoliosis is common, as you said, about 3% of teens who get scoliosis, and unfortunately, most of those people don't end up needing bracing or surgery, but they may do other forms of treatment, as you discussed, like physical therapy. So understanding the illness, understanding its impact on that person, seeking information, just as you said. I think supporting the patient in asking any questions that they have, and also in saying how it affects them, because as you pointed out, everybody is different effects emotionally, physically, in their life. So I think all of that is really important. Having good coping mechanisms is good for all people with, everyday stress and any medical problems. So fortunately, you have art, you have physical therapy, yoga, meditation, mindfulness. I think teaching people and helping them to realize what their personal coping skills are, and helping them to practice it when they're well and not stressed so that they can use it when they are.
When diagnosed, many kids are advised against heavy weights and twisting movements. What activities can a child do with scoliosis, and what can't they do? Can activities such as playing sports or carrying a heavy backpack make it worse?
A lot of back pain, whether with or without scoliosis, is muscular related, so actually physical activity can be very helpful for keeping a healthy back in general. So all the healthy back advice for people with and without scoliosis apply, which is stretching, exercise is actually good. Trying to have good back supports if you're sitting for a prolonged period. Making sure that you try to have good posture, and always kind of helps your back in terms of muscle release. So I think actually activity in that sense can help. Heavy backpacks can cause a lot of muscle pain, so not overdoing it. I like your idea of the rolling backpack. If someone is wearing a backpack, it's better to have it on 2 shoulders as opposed to 1. But again, a lot of it is general healthy back advice.
Thank you, Dr. Cleary. Now I would like to move on to Dr. Dubina. Dr. Dubina, what recommendations do you have for children preparing for scoliosis surgery? How do you support them before surgery and after surgery?
So I think one of the biggest things is early diagnosis, and that helps to avoid surgery. So a lot of people can, if they're recognized early, then you can get to the point you can be either observed, braced, to help prevent surgery. Surgery is the last thing that we like to do, and only if we have to. I think just like Dr. Cleary had mentioned, I think that one of the biggest things is people and supporting them and having their families support them to help their coping skills. And it's tough to go through as a middle schooler or early high schooler, and there's a lot of changes in your life in the situation around you and everything. So I think support is huge. And I think that that's one of the biggest things that you can do as you prepare for surgery, if it comes to that.
As I mentioned in my seminar with scoliosis, a spine can curve into an S or a C shape. This leads me to my next question for you. What is the difference between a C and an S spinal curve? Does one curve give rise to certain symptoms, and how does that affect surgical options?
So most people that walk have S-shaped curves because if one's a compensatory curve and it's compensating for the other curve. So if you want to center your head above your pelvis, kind of how I explained it in the office, if you want to center your head above your pelvis, if you have a curve in one direction, you kind of have to have something bringing you back. Otherwise, you lean way off to the side. Children with neuromuscular conditions, one such thing as cerebral palsy, can give you more of a C-shaped curve. I don't necessarily say that it changes how I treat you, but the symptoms, in terms of the symptoms. So I think that, just like Dr. Cleary kind of talked about in terms of back pain, I totally echo the same thing. And then I find that people with really big curves can have can have pain sometimes, and I try to support them through that. But I think physical therapy and other things are very helpful for that.
Thank you, Dr. Dubina. Next, I have a few questions for Dr. Nelson. When is surgery recommended for scoliosis? Is there an ideal age or degree of spinal curvature recommended for surgery?
That's a great question, and it really depends on the type of scoliosis. So OlaRose mentioned in her presentation that you can get scoliosis for lots of different reasons. And so that's maybe like a bigger discussion, but particularly for adolescent idiopathic scoliosis, it's not necessarily an age, right? You mentioned it's kind of from 10 to young adulthood, really. And so any of those ages are fine for surgery. And so there's not an ideal age within that range for adolescent idiopathic scoliosis. We like people to be, in terms of surgery, curve size, traditionally for spinal fusion, we say upwards of usually 50 degrees. There's nuances to that, but that's pretty much traditionally. And then with the newer techniques that you had, for example, the vertebral body tethering, there can be not only depending on the age, but the curve magnitude, different recommendations. And those recommendations are actually still being refined because that's a newer technique.
Well, this, I guess, leads me into my next question. What is the difference between spinal fusion and vertebral body tethering? What other surgical options are there?
Right. So spinal fusion, as as it sounds, means the fusion part means we knit the bones together. Usually we do that from the back nowadays, so it's called a posterior spinal fusion to prevent the curve from getting worse. Right, because our big concern is these curves progressing further to cause more problems in the long run into adulthood. And so that would be considered sort of the gold standard method that we have the most information on, the longest term follow-up. But it takes something that's supposed to be flexible and it makes it stiff because of the spine fusion. So there is a newer technique called vertebral body tethering that is an anterior fusionless technique to treat adolescent idiopathic scoliosis. And so it's a flexible rope, we call it a tether, it's a rope-like material, and the hardware goes into the anterior part of the spine, and it's a guided growth technique. So the idea is if there's enough growing left to do, and the curve is within surgical indications, that perhaps we could kind of grow the spine straight, which is pretty remarkable. Again, the indications for that, I would say, are still being refined, and we're still gaining more knowledge about this newer procedure, whereas we've been doing spine fusions for many, many years. So we have a lot more information about the long-term effects of that.
Thank you, Dr. Nell. Ms. Helen Harris, I would like to ask you a few questions about physical therapy. Is there an optimal age or spinal curvature to start physical therapy? How do you know when a child is done with physical therapy?
Good question. The simple answer is the optimal age to start physical therapy is when we identify the curve. Sometimes PTs work with people of all ages. So I started out working with infants. With infants and young children, the emphasis is on developmental stages and primitive reflexes, that sort of thing. With children starting at about the age of 7 and continuing through adulthood, we use what's called scoliosis-specific exercises, and those are carried out both in the clinic and in their activities of daily living. In terms of when you stop physical therapy, some people use skeletal maturity as the time to stop attending physical therapy. That's assuming that they understand their curve and how to find trunk balance in daily activities. Some people continue throughout their adulthood with an as-needed intervention when they face a new challenge. So the transition from high school to college can present a challenge because lifestyles become more sedentary when they go to college. Pregnancy and childbirth can present a new challenge because of the changes in the spine support. Menopause presents a challenge. Other older adults sometimes report that their curve is progressing due to changes in their lifestyle, as well as bone metabolism. Thank you, osteoporosis.
Thank you. Every child's scoliosis is different. Kids with scoliosis can have concavities and convexities in their body. How do you tailor physical therapy and breathing exercises to a child's specific curvature and body? How does physical therapy differ between a child before surgery and a child after surgery?
Thank you for bringing up the breathing exercises. The breathing is the foundation of the exercises, and the exercises are part of all the therapeutic interventions for scoliosis and incorporated into every position. So learning about rib expansion and diaphragmatic support is key. When breathing is part of the exercise, a new movement pattern becomes established and becomes a new habit during activities of daily living, sports, dance, music making, and recreation. The diaphragmatic breathing incorporated into the postural corrections helps to minimize the curve progression, improves the postural endurance, and often reduces pain levels over time. So for instance, when you're sitting in your self-correction and you start to feel yourself lose your position, all you can do is start your diaphragmatic breathing, and then you start to regain some of your control.
Thank you, Ms. Helen Harris. Ms. Coleman, in your yoga class, how do you adapt yoga exercises to meet the needs and restrictions of children with scoliosis?
Thank you, OlaRose. I just have to start by saying, not only am I a yoga teacher, but I am someone with scoliosis. And I was diagnosed at a very young age and wore a back brace, and my curvature got up to about 45 degrees. So I was able to work with Sue Callan-Harris since I was about 12. There you go, 12. And it has been a really powerful journey for me, and I truly see myself in all of my students. And it's allowed me to lead with compassion and a deep understanding of what it's like to have scoliosis, and I think that it's just added so much to my practice myself. And I feel like my inner child is being healed simultaneously while I'm able to give to my students, so it's been really powerful. So as far as adaptation in a yoga class, I do teach based on evidence-based practices and coursework that I've gone through, but a lot of it's from my own experience in yoga as well as physical therapy, and I integrate all of that into my work with my students. So one of the biggest things is teaching my students about their bodies, becoming very, very aware of every part of your mind and also of your body so that you can make your own decisions on what to do. So for instance, we use a lot of props in class, mostly blocks and straps, and I try to empower my students that those are not being used because there's a deficiency or it's weak. It's actually really powerful and really amazing to utilize these tools that help just bring the ground closer and make these poses and positions more accessible and safe. So one of my favorite things is when my students grab props on their own without me even saying anything, that's the work, and that's what my goal is. We'll modify poses that may cause pain or enhance the curvature. So there are some things that we try to do less of, more infrequent and definitely not holding it as long, such as twists, side bending, extension and flexion, so think the arching and rounding. Although those can maintain flexibility and they are helpful, we don't want to hold them for a long period of time. All of the self-corrections learned in individual physical therapy are incorporated into my class, and that's where each student with their own unique bodies know how to move in their own unique way. We develop templates, so a template might be, okay, when we're in side plank, this leg's gonna go here, or this arm's gonna be here, and it's different for everyone. We'll workshop that, and then we'll generalize it. And speaking of generalization, I think the last point is that it's important to take what is learned on the mat and generalize it into your daily routine off the mat, and I think that's where the power is in your everyday routines, such as your head and neck alignment when you're texting, when you're reading a book, or doing your homework.
In what ways could a child with scoliosis benefit mentally, socially, and emotionally from incorporating yoga into their routine?
This is such an important piece of all of it. A lot of people think yoga is just moving, downward dog, tree pose, but there's so much more to that. And the mission statement in my yoga certification through Little Flower Yoga states that their mission is to help kids thrive in a world regardless of circumstances and navigate the many challenges they face with a sense of personal power and self-awareness. And I try to take that mission and incorporate it into my class every week. Everyone's different, everyone's gonna have their own journey like OlaRose had mentioned. For me, I like to use humor. So for instance, when I was young and I was babysitting a little girl, I was babysitting age, of course, and she had put her hand on me and I was wearing my back brace, and it's obviously hard plastic, and she kind of was like, whoa, what was that? And I showed it to her and I told her that I was half Barbie, and she thought I was the coolest babysitter ever. So sometimes you have to use humor and to bring levity to a situation that is challenging and great self-conscious tendencies. One thing in my class, I really try to strive to encourage my students to understand their patterns of thought. Where does your mind go? What is your self-talk? What is your self-image? And where are you in your confidence? And using yoga and mindfulness to empower yourself to shift your perspective. I know OlaRose had mentioned perspective, and it really is all about that. My class is meant to provide a sense of belonging. I also felt alone. My mom was a huge advocate for leading me to Sue, who I was able to connect with other kids with scoliosis, but I knew one other person in my middle school and high school that had scoliosis and wore a back brace. So I did feel alone in my journey. So my goal for my class is to bring in community. We know that the community is where the work is as well. So I think that's been really powerful. One of my favorite things, and I'll close this up, is observing, sitting back and letting the conversation happen in the beginning of class. I really like to have that time, and I'm noticing my students are giving each other advice. They're sharing about their experiences with their brace and talking about things that no one else would really understand or be able to guide them in. So sitting back and just holding the container, holding the space for all of that magic to happen, I think is really powerful.
Thank you, Ms. Coleman. Lastly, I would like to ask you, Dr. Cullerton, a few questions about your experience as a parent of a child with scoliosis. As a parent, it must be difficult to see your child going through something like this. As you navigate this journey with your child, what have you found to be helpful in managing the emotional effects of scoliosis for you or for your child?
We're new at this, so you're catching us at actually a rather difficult week. You know, my youngest was diagnosed with scoliosis in January. We were very fortunate to find the group at Callan Harris to kind of help us navigate some of the emotional side fairly early on, but you get this information and then you come home and then there's so many questions that come up and just one after another leads to the next question and it's very overwhelming. So now we're at the point my youngest picked up her brace this week and has been bravely getting used to that. And my other child was also diagnosed with scoliosis this week. So we have had a long week, but we are, navigating it together, trying to remember that we're still the same people we were a few weeks ago, and we still do and love all the same things we have loved. Just knowing that we have a support system among our family and trying to figure out how to tell friends and how to make sure we're using all the tools and doing the absolute best thing for our kids. As a parent, the emotional side for yourself is constantly second guessing, are we doing all the right things? But then also helping your kids remember how strong they are and how good they are at navigating difficult times. And it's gonna make us stronger in the end. And we're still the same people, so that's the biggest, yeah.
My final question for you is, what advice would you share with parents whose children are newly diagnosed with scoliosis?
I think the theme here today has definitely been support system. Not just scoliosis, but I've been thinking so often about every parent out there with children who have seemingly invisible conditions. The tough part about scoliosis is sometimes you wish it was totally invisible, that there weren't physical side effects and bracing and things like this that make it so obvious. But all parents, have to address the situation in the way that they can for their own unique child. Two children with the same condition, very different reactions and ways of dealing with it. And so knowing how to give everybody space to process in the way that they need to is huge.
Thank you, Dr. Cullerton. That was my last question for the panelists. Thank you all for sharing your unique perspectives and insight about scoliosis.
Yes, thank you to all our panelists for coming out here today. Now, first, before we let you go, we want to have a bit of a dialogue. So if any of you have any questions or commentary about anything any of you have said, is there anything you would like to share with each other?
I have a question. When I'm talking to people about going to physical therapy and I have a lot of people that come in and they're at the end of their skeleton, they're like close to skeletal maturity. Do you still find that, and I tell them that I still think that shock therapy is helpful. And do you find that you're working with people well into their adulthood? And what are you working with them that's different than when they're teenagers?
Good question. Thank you. Yes, we are working with people as teenagers. I also work at the University of Rochester with undergraduate and graduate students, and there are so many people who come in who have scoliosis or kyphosis and so wish that they had understood it earlier, but there's still time to find and develop what we call trunk balance. So maybe we won't change the bone structure itself, but we can still work with the muscles for what we call core control, and you can still find your positions of relief, positions where you can get the best trunk balance so that you don't have pain and you don't have interference in what it is that you want to do. So musicians can still learn rib expansion, and dancers can still dance even with a 45, 50-degree curve. We find athletes can still participate full out in their athletic events, even if they have an advanced curve, because there's still something you can do with your muscles to get yourself out of pain and be able to perform.
You're here. That was great. I like to call that spine hygiene. Spine hygiene. Yeah, you need to do that. Everyone needs to do that. I was just going to comment as we were discussing how to support our patients. that we do have a program at the University of Rochester called the Pediatric Perioperative Wellness Program that does help support kids who are facing the possibility of an operation. Mindfulness techniques, coping with stress, and I think that that's something that is fairly new to us, but it's really important for us as surgeons to offer our patients, in addition to all of the wonderful things that we've talked about here today.
And we have our other microphone there, which I will leave here with our panelists. And then we want to open the floor to any of you. If you have any questions, yes, we'll come right here to you.